Robotic surgery, because of the fact that it's minimally invasive, just requires less healing, and particularly less healing of the abdominal wall. When there's less pain in the abdominal wall, the patient can return to normal activities, such as walking, exercising, golfing, tennis, or work sooner.
I was surprised at how fast the recovery was. It was just a couple of weeks, and everything seemed pretty much back to normal. I was back on my feet. I was able to go back to work. I was able to work out. Erectile function was starting to come back very slowly, but I was really happy with the recovery process. That was the great thing about Dr. Ruckel. I never had really a darkest hour. I always felt like I was in really safe hands throughout the whole process.
Most patients who come to us don't really know about robotic surgery. That's one of the things that has been surprising to me, is that patients many times don't know what options are available to them. The biggest misconception I think people have about robotic surgery is that it is not under the physician's control. Most patients, when they first hear it, are a little nervous or a little scared about what robotic surgery really means. I've had a few patients that said, "I don't want robotic surgery, that sounds scary to me, I want you to do the surgery." So I explained to them that robotic surgery is simply like any other tool that's under our control and is used to help make the surgery easier and better for them.
I was very comfortable having left Dr. Bali's office, knowing full well that they were looking after my entire holistic. It was a holistic health approach rather than just, well, let's just, get to the root of the problem and that's it. I was so impressed with my treatment throughout the entire process that I opted to give back to the hospital and try to be involved as much as I possibly could. I would wholeheartedly recommend the robotics procedure through Loma University Medical Center, because they're top in their field, and this is just one more example of that they're at the top of the game as far as the healing and promoting holistic health.
One of the huge advantages I think I see in the future for the robotic system is both gynecologic cancers and gynecologic prolapse type surgeries. These are very complicated surgeries that require lots of very precise movements, lots of suturing, working in areas where there's a lot of very important structures, such as major blood vessels. And with the robotic system, you're able to completely control your movements without tremor and seeing everything magnified.
I've practiced medicine in many different kind of healthcare systems, and each one has some sort of different advantages and disadvantages. And I think Loma Linda has a unique blend of being a moderately high volume center, high enough volume that we're very, very good at doing the operation, but not so extremely high volume that patients are like cattle and they just come in and you don't know their name and you don't really know anything about them, and you just have 6 patients and line them up and you don't see them back for follow-up, you don't have a relationship with them, you don't take the time to know what the patient really wants and what's important to them. This whole hospital is dedicated to excellence in a way that I've never seen in any healthcare system I've worked in before. It's a joy to come to work, and it's a joy to come to see my patients in the clinic afterwards, because uniformly they rave about the wonderful care they got.